It is both a big honor, but also a responsibility. We have very loyal audience, and their expectations that each year we'll come up with a new material, with a new program that will be just as interesting and useful for our audience members. So I will work very hard with the organizers of the conference and my colleagues on the steering committee to indeed provide new material and speakers who will meet our goals and our mission. Namely, what we're trying to accomplish is find a group of experts who are also original and creative thinkers, but who have an additional quality of being able to engage our audiences. Our main purpose would be to provide content that is a compilation of sophisticated, emerging science about disease states that are of interest to psychiatrists, but also find a way of translating that advanced knowledge into clinical practice. So it is both knowledge and novelty, but also applicability. The other goal that we have is to try to provide information about a wide range of topics. So in addition to some of the common disease areas that are focus of many other psychiatric meetings, such as major mood disorders, thought disorders, anxiety disorders, we will make sure that our audience members can learn about eating disorders, about issues of ethics in psychiatry, substance abuse, medicine, psychiatry, and law. So wide range of topics that we're expanding, and we're trying to respond to our audience's interest and include always new material. Well, what I would do is paraphrase some of the comments that we have had. We have very loyal audience. In the course of last few days, I have met with several colleagues who have pointed out that they're coming to this meeting for the last 5 or 6 years, and what they like about it, it is most clinically relevant. Unlike some other psychiatric meetings where they will maybe hear updates on the research, this is something that they feel will be of use to them in their office next week. So that is something that is very often highlighted. Something else that audience members point out is the friendly, relaxed atmosphere, and also interaction with other participants in the conference. So there are conversations, people laugh, enjoy meals together. So it has become a multi-purpose event. It's a place to get knowledge. It's also a place to meet colleagues and learn new things and enjoy the time here. There are multiple reasons why residents might enjoy this experience. Every psychiatry training program has its strengths, but there are very few programs that have strengths in all the areas. Therefore, coming to U.S. Psychiatric Congress provides them with an opportunity to have up-to-date information on multiple disease states. So it's a very comprehensive way of grasping where the field of psychiatry is going. But aside from educational purposes, this is also a place to make friends and new acquaintances, learn about work opportunities, have an ability to have a conversation with colleagues who maybe have more clinical practice. So I think it is that exchange combined with a very wide learning opportunities that they might find appealing. I was involved with a couple of different sessions. The sessions that were very intriguing had to do with schizophrenia, but it was a particular focus on schizophrenia. Aside from understanding a disease state, we're trying to move away from purely descriptive nomenclature. We would like the participants of this conference to have a little bit of deeper understanding of what schizophrenia is like. We will introduce very controversial questions, as in, is schizophrenia a single disease or not? And I think that direction that we're leaning, it's probably not. There are multiple diseases. So if there are multiple diseases, how do we approach their treatment? Well, we try to find commonalities. Although there may be neurobiological diversity, maybe there's some common underlying mechanisms with which we can interact with our treatment modalities. So it is a comprehensive brain-body approach to schizophrenia. The focus of our presentation was on cognitive and negative symptoms of schizophrenia. There's particular reason to highlight these issues, because these are the symptom domains in schizophrenia that most interfere with the individual returning to proper social functioning and occupational functioning. So we provide a bridge between advanced scientific understanding of this disease state and how one might start to approach it in private practice setting, community psychiatry, mental health center. How does one utilize this knowledge and apply it in the setting in which they live and work? I'm not sure that there will be a dramatic shifts in course, because I think that the main principles that are represented in U.S. Psychiatric Congress is something that our audiences enjoy. So rather than dramatic shift in course, it will be more change in content, and it will be more building on what we have achieved this year. So we will try to seek out teachers who are even better in conveying their knowledge, their clinical expertise, their original thinking, and helping our other colleagues have better results with their patients. So instead of having a radical shift, it will be just advancing what we have been working on for the last few years. The way we view it is that building U.S. Psychiatric and Mental Health Congress is not one event at a time, but rather a process, a direction, a path. And we hope to continue on that path and continue to improve. I would like to take this opportunity to thank all our attendees for spending time at the U.S. Psychiatric and Mental Health Congress in San Diego. We hope we'll be able to see you next year, when we will have some new topics and new content for you. This would be also a good opportunity to make some new friends. So all of you psychiatrists and mental health workers who have not had a chance to experience U.S. Psychiatric and Mental Health Congress, please come and join us in Las Vegas from September 30th to October 3rd next year. Thank you. I hope to see you next year.